Okay, we're back. And I just want to let everybody know my battery life is at 46%. So I'm hanging on there, but by a thread. I want to talk about the DNRs and the vents. It seems that apparently they go hand in hand. I never knew that, but apparently since COVID they do. Scott, can you tell us the difference between the DNI and the DNR and how the hospitals interpreted it as if you refuse the vent, then the hospitals claim that, well, you refuse life-saving measures, like a vent was the only way to save your life, apparently. Could you explain that for us?
Sure. Just to give the backdrop, what happened during Grace's hospital stay, I got educated on vents. So unlike Greta, who was familiar with vents before she went in the hospital, I was familiar with remdesivir before Grace went in the hospital, but I was not familiar with vents. And so when the doctor, Grace's second day, said, "You're going to need to put Grace on a ventilator in the next 2 hours," I said, okay, what's going on here? What's the prognosis? And that got me into studying what ventilators do. And I found out very quickly it is an incentivized tool in the toolbox. I didn't learn about the incentives till after I started researching, but I saw that the kill rate in some of the research articles I was looking at was between 80 and 90%. So I thought, well, what's going on here? And we were pressured to give the hospital a pre-authorization to put Grace on a ventilator just in case. So they would frame it this way, Greta. They would say, these types of things tend to happen in the middle of the night when we can't get a hold of the family. And so that's why they wanted to give us to give a pre-authorization. Well, I found out subsequent, the reason that they were even asking for a pre-authorization, so that's a version of informed consent, was because ventilators were approved under the emergency use authorization. So they had to get informed consent approval for a ventilator. Well, ultimately, we did not realize how the hospital looked at DNI. DNI is do not intubate, until we got into depositions. So once we were into discovery, which part of discovery is depositions, one of the nurses, she explained that if somebody is DNI, that's the same as DNR, do not resuscitate, to them in the hospital. So once we said we wouldn't give the pre-authorization for a ventilator, internally, they considered that DNR, and that was what the doctor used to put the DNR order on Grace's chart without our consent. And I just want to say this regarding, COVID has been studied by a number of organizations now, and statistics are coming out as to what's going on. And, Grace had Down syndrome, as you know. I personally believe that is one of the reasons that she was taken out. And this article, I just want to quote from this article. I put it up on my screen just in case you asked that question. So this is from the American Journal of Medical Genetics. And this article was written December 12th of 2023. The title is Retrospective Review of Code Status with Individuals with Down Syndrome During the COVID-19 Era. So, that you can't get more specific than that. So here's what the article said. So it went on to explain that when they got their survey, which was from January of 2019 through June of 2022, if the patient had Down syndrome, he or she had a 630% more likely chance to have a DNR order put on their chart. And how they came up with that statistic is they reviewed 1.7 million patients across 825 hospitals to come up with that statistic that if you had Down syndrome, you had a 630% chance, more likely chance of having a DNR order on your chart. But ultimately, the answer to your question is, you probably remember at the trial, Greta, this was asked to me on the stand. And I said, why didn't the doctor just say something so simple like, hey, just so you know, if you're not going to give us a pre-authorization for a ventilator, we call that DNI, do not intubate. And DNI to us means DNR. All the red flags would have went up right then, but they, why wasn't that explained to us? And, that's one of the many reasons I believe Grace's Down syndrome had an impact as to what happened.
Well, I think it was intentional too. I think that why didn't they put that purple bracelet on her?
Well, there's a lot of things that are nefarious relative to her hospital stay.
Because that would have indicated.
Well, think through, you might remember the last, I'm going to just go on one rabbit trail real quick here, but the last day of the trial, we knew the judge was leaning towards this concept that you're giving implied consent just by going in a hospital. I mean, that's insanity. How is it possible? You're just giving a blanket consent. And so we knew that there was a fraudulent record in the medical records. And so we brought that in when I was on the stand the last day of the trial to show that it was fraudulent, to hopefully convince the judge to not buy into this implied consent theory. And the fraudulent document that we brought up showed that 17 minutes after Grace and I went into the emergency room, somebody had a phantom conversation with Grace while I was in the room, and Grace approved the general consent document orally. No signature of the person who supposedly had the conversation with Grace, no reason why that conversation happened, all of which are supposed to be on the form. So, I mean, it was obviously a fraudulent document. We showed it at the trial, but it's a different animal once you get into a trial.
I just remembered something from the trial. Are you back, Greta? Well, I was going to say, I remembered something from the trial now when one of the jurors asked you about ivermectin, and my antenna went up, and I thought, they're not on our side.
Exactly.
You remember that?
Yep, I remember very well. It's hard to grasp some of those questions, and I enjoyed that opportunity. I like the fact that the judge let the jurors ask questions because nobody can prep for that. And I knew the material as well as anybody, so I welcomed that opportunity. But when that question came up, I thought, oh boy, yeah, they're not understanding what this case is about. So, I mean, Dr. Bowden, have you experienced this also, where hospitals internally say that a DNI is the same as DNR?
I can't recall a specific instance, and I wasn't in the hospital during COVID. So when I was more active in the hospital setting, it was a big deal to put something on a DNR was not just slapped on somebody's chart haphazardly without
correct
consent and a signature. You had to have a signature. That was not an oral DNR. There was a big sign. We didn't do bracelets, so it was more like a big sign on the, outside the door, or it was very clear. It wasn't subtle at all. Or there was no room for a misunderstanding.
Exactly right. I mean, it seems it's the most important thing you could ever agree to in your entire life. So how could any person unilaterally do this other than the person themselves? It was hard for me to grasp. Go ahead.
I wanted to say, I'm discovering, looking at all these medical records and things like that, that they were making money throughout the whole protocol. And obviously they would get money off of a deceased COVID patient, but they got money after that too. And this was hard for me to believe, but I'm seeing it there. And I actually want to show y'all this next clip about how they continue to make money and why they may have pushed people to get to an event. It may have been more than just what we thought. So Chris, can you play clip 4?
When you were, after your father died, your sister got a letter in the mail thanking her. Can you go ahead and tell us that story?
She received a thank you letter from the Organ Donor Association, thanking my sister for my father's eyes.
Yeah, his corneas, right? Yeah. And what did she say in response to that?
She contacted them. They never got back to her. She contacted the funeral director. He never got back to her. It's like the funeral director was the last person to see him.
He would know.
He would know.
Right. And so you just get this random thank you note for organs, and there's no explanation about it, even though your dad wasn't a donor, right?
No, he was not.
I typed in what is the most transplanted organ, and it always comes up kidneys. And then I looked into corneas, and so then I looked up how many transplants there were for corneas. There's 80,000. And how many transplants are there for kidneys? And there was only 27,759. So kidneys aren't the most transplanted organs. It's corneas.
Christy's mom, Joyce, was referred for organ donation. Her medical records show that the doctors recorded she met the criteria for referral and they would be referring that day. Later, it was recorded that she was not a candidate due to COVID pneumonia. So what is the criteria for organ referral? During COVID, if you were considered or evaluated for withdrawal of a ventilator support, you were a candidate. This applies to all ventilated patients regardless of neurological function. Also, doctors were to call on all patients regardless of age, diagnosis, or condition. These patients were potential donors. Not only were hospitals paid to ventilate patients, they also got reimbursed through Medicare and private insurance when they referred patients for organ donations. Hospitals typically bill for organ acquisition costs through Medicare reports or through the patient's insurance directly.
With procurement firms actually recruiting donors and acting as organ brokers based simply on supply and demand, purely economic approaches to organ donation, the human body literally becoming a commodity to be bought, sold, and bartered for in a manner similar to any other good or service.
So regardless of the condition of the patient, if you were ventilated, you were referred to the organ harvesting organizations there. That was Methodist Hospital. So all of their COVID patients were referred to organ harvesting if they were on a ventilator. And if they were going to come off of the ventilator. So Dr. Bowden, if the vents were meant to save the patient's life, why would they refer them to an organ donor? I mean, wouldn't you need your organs if the vent saved your life?
Right. Well, when I read that though, it sounded like they were withdrawing the ventilator to let them die. Is that what? I mean, it was kind of fast, but
that was regardless of their condition. If they were on a ventilator, they were referred. So the first part of it was if they were withdrawn, and the second part was all COVID ventilated patients were referred.
Wow.
Yeah.
That's crazy that woman got a thank you note on her. Did she ever get any kind of closure on that, or just?
No. As soon as she mentioned that he wasn't an organ donor, there was no contact after that. It was like they didn't want to talk to her anymore. So, yeah, to me, that just, and then there is another clip, and this is actually my experience with my daughter, that, people are like, you get it off of your driver's license if you don't want to donate. No, that's not the way it works. When you go in and sign those electronic forms, and I don't know, Chris, can you play clip 3? I don't know if you can go back. We'll see. Consent. Sign here on the electric dotted line. No, print it out for me. I want to read it. Do you know what you're signing? And these are things that you do not have to agree to these in order to be treated.
We don't know. Like you said, we don't read this stuff. We got to start reading.
When you sign it, you're agreeing to this. It says, I agree and understand that the facility may be a teaching facility and residents and fellows and students and all these people can participate in my care. I don't agree with that. I'm there to see a doctor who's supposed to be a licensed professional who knows what they're doing, and that's who I want to see. So I scratched through all that and I put, I do not consent. And then next it goes back to testing. And you're consenting to testing for any communicable disease in the event of an accidental exposure. Then you've automatically agreed to a COVID test. Well, you're not in there for a COVID test. And so if somebody walks in with COVID, then everybody gets to get tested because they've already tested a grapefruit and it comes back positive for COVID. On release of info, it says, I agree and understand that the facility may release my healthcare information for payment purposes. And so people would say, yeah, this is about payment and move on. If you look further down, it says, I also authorize the release of medical information to organ transplant services.
Hell no.
Should I be identified as a potential organ donor? So the doctor will identify you as a organ donor.
Listen, I came in with my organs. I'm going out with my organ. Okay, what happened to my body, my choice? So they would record your kid?
Yes, and photographs and whatever, that would become property of the facility and they could use it for whatever purposes they wanted to use it for. And then the final two things were stuff that I actually added. I am the legal guardian for my daughter and I will have informed consent on all medical treatment prior to agreeing and consenting to treatment.
No vaccines or testing will be done without my consent. I require and request itemized list of billing for patient's name for the treatment. Yeah. And then they would have to list any kind of drug that they gave her, because once we get an itemized billing, we know of every medication that you've given her.
So smart. That never would have occurred to me prior to COVID, is go through one of those long electronic consent forms.
I'm in the same boat at 100%. I mean, now everything you have to go through with a fine tooth comb. What am I agreeing to? One of the things I was thinking about with the clip before this one is just think about if the doctor had to disclose the conflicts of interest as part of their profession. I think, Dr. Bowden, I think on your X account, you showed that if you would have bowed to the COVID shot agenda, I think you would have got commissions of like 1.5 million or some crazy number. But what if the doctors had to disclose that? They had to disclose these commission relationships. I mean, I think people would have a completely different view of the medical profession that they have been programmed to blindly trust.
Exactly. Like the situation with the statins and your doctor. Yeah, no, most people had no idea that that's part of the reason that their doctor is encouraging them to take a statin.
Yeah, it has like a 3-second delay, but we are actually trying to hook up to vehicles now. So this is our desperation. We're trying to run an extension cord to hook up my computer to my husband's truck, as this is crazy. But I want to move on, and I'm skipping some things that I had lined out here. But I want to move on to these drugs that were used in the hospitals. And I want to basically show, I was curious as to, everybody said this is like a combination, a death in lethal injection. And I thought, well, how do death row inmates die? And so I looked up that combination, and I actually looked up all the drugs that are commonly used in hospitals and categorized them parallel to the drugs they use to kill inmates. And what I found is in all of these cases that each category was filled. And it was usually the last drug was usually some type of painkiller, morphine, fentanyl, something like that. And when that worked in conjunction with the other two drugs, the neuroblockers and the sedatives, that those three worked synergistically and killed the patient. And so I wanted to show the picture that I have next. Chris, if you can put up Pt2, and you can see the different drugs they have there. I don't know if y'all can read that or not, but some patients were actually given the exact drugs that are on that death row concoction there, all three of them. And this just surprised me. And Scott, I know in your case, they talked about the synergy effect of those three, and you had an expert witness. Can you explain that a little bit more?
Yeah, so Grace was given Precedex, lorazepam, and morphine. So first of all, Precedex is not supposed to be used for more than 24 hours, but then it's also not supposed to be combined with benzodiazepine like lorazepam. Well, then you get to the black box warning on morphine, and it says don't combine all three of those unless you are directly monitoring the patient bedside and have the reversal drug present, because it can cause death. And this is a big deal. Dr. Burdine, who was our doctor expert, he said not only do these meds combined are a problem, but they're synergistic. So the side effects of, like, for example, a Precedex are exacerbated when you combine it with lorazepam and further with morphine. So the synergy of those drugs we know that that's what killed Grace.
Yeah, and basically that synergy, it is meaning that the drugs amplify each other. So Correct. They work in a greater together in a combination than they would independently. And so people don't seem to understand that, that each drug, they each have their own side effects and all that stuff. But then when you combine them, you have a whole new ball game, and it's usually not a very pretty ball game. So with that being said, I want to go to another clip, and Dr. Bowden, I want to ask you, let there be light. I want to ask you, did they teach all about that kind of stuff in medical school? I'm kind of, either answer you give me, I'm gonna, have a, probably disappointing outlook on it. But what did they teach you about the drugs and the combination of drugs and things like that?
Yeah, I mean that's basic. It's not that's not anything advanced. The nurses know it too, even though they didn't go to medical school. It's pretty basic, common knowledge that you combine those three types of drugs together, you something bad could happen. That's
Yeah. Well, I will say, if I can figure it out, and that's what I said, if I can figure it out, then surely highly educated doctors and nurses that have been working in their field for decades can figure this out too. That's what makes me think that, the good ones were really run off with the mandates, and that left the ones that could be controlled. I mean, and that's what happened. And I'm sorry to say that, but brainwashed and controlled people are what followed through with all of these things, because any person with logic and common sense would have never done that. I want to show clip 7 real quick, Chris. And this is of the opioids they used. So, well, it kind of went quick. Try it again, Chris. There we go. So we have a baseline of morphine. So we have oxycodone, which is 1.5 to 2 times stronger than morphine. And then we have methadone, which is 5 to 10 times stronger than morphine. And which is funny, because if you're trying to get off of oxycodone, they're going to put you on methadone, something 10 times stronger. But what most of these patients that I've looked at their medical records, they were given fentanyl. They were given the most powerful drug that the hospital had to offer. And so you can take that down, Chris. And so their excuse was that it has such a short half-life. It's only 2 to 4 hours. And the half-life is the time it takes for half the drug to get out of your body. Am I correct on that? Okay, I want to make sure, because I've been studying, I've been doing my research, and I started questioning. And one thing led me to another. So put up pic 3. I want to show something about fentanyl. So the half-life of fentanyl is 2 to 4 hours, but they want to reach something called a steady state, which is when the intake of the drug is equal to the elimination of the drug. And with fentanyl, the steady state is usually reached between 6 to 12 hours. But what they don't tell you is that the half-life increases after those 6 to 12 hours to 7 to 12 hours. And so in that case, you have the drugs stacking on top of each other until eventually you have an overdose. And so no one ever mentions that. And you can take that down, Chris. And so fentanyl is, by the way, I didn't point that out, it's an off-labeled use drug to treat COVID. And why would you go to the most potent one when the medical records say that the pain level of these patients were 0?
That's right.
I was on the phone with one woman, and when she found out that her husband was on fentanyl, because we were talking to the doctor too, she said, why would you put him on fentanyl? For every 30 minutes he was on it. And that, as the nurse saw that he needed it, based on the grimace scale, which is when you make a face or something. Well, I grimace when I sleep, so nobody comes and pumps me up with fentanyl while I'm taking, having a bad dream. But apparently they did for this poor man. And she was so upset. She said he just had double knee surgery last year and he refused Tylenol. So, but they took it upon themselves to say, oh, he needs fentanyl. This is, to me, you can't be this incompetent. You can't be this negligent. This, to me, just seems so intentional. And I hate to say that, because I went in trusting these people to help me, but all the evidence is not in their favor. And so I don't know. What are your thoughts on that?
I'll say, if you're on a ventilator, you do need a lot of drugs to tolerate it. I mean, you can imagine if you had this plastic tube in your throat and your wake. But I think what's so wrong with Grace is she wasn't on a ventilator. Right. And yeah, it was just, and I know that what happens, patients would breathe really rapidly and appear to be in distress. And so there's this balance of helping them relax a little bit, but they obviously took it way too far with Grace. But
would you Would you think that 43 medicines at one time is too much? Because that's what they have. I have a clip of that too, of 2 different patients with over 40 medications. And we're talking all of those in that category of the death row drug. I mean, it just, I tried to reason it myself, but I can't. I can't, and then like they tell Scott, they're commonly used, so we don't have to disclose those.
Yeah, that's
No.
what I was going to mention, Greta. That was maybe the most frustrating thing from the trial, was that you can get experts on a stand to say this is normal, and so consequently informed consent is not necessary. So, as a result of the trial, I have come to grips with that. The whole informed consent dialogue is actually a dialectic. It's to get us in the trap to demand informed consent. Well, when we demand informed consent, we're in their trap, because what are we demanding informed consent for? We're only demanding informed consent for the things that are in their system. I want informed consent for things outside of their system,
Yes.
but they cannot give us any of those, because the entire system, that's why I say you got to get a medical professional. Praise God that Dr. Bowden woke up to that, and she's a cash pay doctor now outside of the system. You've got to have that. Otherwise, all they can ever recommend is things within the standard of care system, which is by design to hasten your death.
Right. Like when I asked about the side effects for the drug they wanted to give my daughter, I said, what are the risks here? What are the side effects? And he looked up at the ceiling. I guess the answers were on the ceiling. And he said, she'll get sleepy. And that was it. And first off, I don't think there's a single drug out there where the only side effect is you'll get sleepy. And I said, no one's died of sleepiness that I know of. I said, I would like to further research that on my own, because they'll only give you, like you said, they'll only give you the information that they have.
Right.
Right. And the very, very little bit. And so then you're still depending on their knowledge and their understanding, and whether they don't know just by, ignorance and not, not being mean or spiteful, they just don't know, or whether they know and they're keeping it from you. We don't know that. We can't read their minds. So like Scott said, you would have to have somebody who has this knowledge, or you would have to be able to say, okay, this is not a dire situation right now. Let me get the name of this drug. Let me look up this drug. Let me find this out on my own, because we're in an age of information. And that's what I did. I looked up everything, and I was like, no, we're not giving her this drug. It's not happening. And so she's been fine. She's never had another issue since. But that's what we really have to look at. But when you said something about ventilators, and what I did not understand is that they would tell patients that their oxygen was in the 90s. They were talking, they were walking, they were eating breakfast. People were saying, oh, I'm going to come home tomorrow. And then the doctors would come in and say, you need to rest your lungs. What exactly does that mean, Dr. Bowden?
Yeah. Well, yeah, if somebody's like hyperventilating and they look like they're really heaving, and, it's distressful, both the patient and the person watching this, because it looks like they look like they're dying in front of you. And that's, I could understand how a doctor might say, yes, you need to rest your lungs. But yeah, if you're eating and drinking and talking, and that doesn't make any sense whatsoever.
Yeah. And that's exactly what happened to another patient. And Chris, can you play clip 6? The doctor even recorded their conversation, and his words were, he felt fine. And she recorded that. But she said he needed early ventilation. Go ahead and play clip 6.
Jenna's husband, he was standing up and talking to them. So that's what I really didn't understand. Matter of fact, go ahead and put up pick 8, Chris, and I'll show you about what I'm talking about there. So with Andy's situation, they were talking about him being ventilated. And the nurse had put in her patient's notes that the patient states he feels okay and I'm fine. Those were his words in quotes. And she said he's agreeable to staying prone and not moving. I told him that it is best to intubate him before it is an emergency situation. Well, his voice understanding, and again stated he is fine, quotes. So, okay, thank you for showing that, Chris. So as you can see, he's sitting there telling the nurse, I'm fine, I feel okay. You're sitting up, you're walking to the bathroom, you're talking, you're telling people you're fine. Ventilation is not resting your lungs, okay? Ventilation is life support. That means when you are unable to support yourself for breathing, you get a machine to do it. And she says it's best to intubate before it's an emergency situation. Life support is an emergency situation. You wait until it's an emergency before you resort to that. And here she is trying to talk him into getting ventilated before he's even in an emergency situation when he's sitting up and fine. I just thought this was amazing to me.
It was 24 hours before he was vented, that nurse note.
Yeah, so basically she was getting him prepared. They had already decided they were going to ventilate him.
So, what are your thoughts on that? Both of you.
It might have been, they were trying, it's kind of like a planned C-section. They don't want to get up in the middle of the night and ventilate and put him on a ventilator. That was my first thought.
And you say middle of the night, that's when I got all of my medications. That's when I got all my testing done. That's when they came in the middle of the night to do everything. They never did it while my husband was there visiting. The only time that things that happened during the day is when the doctors would come in and tell me you're going to die, and then they would leave, or you need to get vaxxed, and then they would leave, But as far as testing and medication, that was all done at night. And I heard story after story after story about, I got a phone call. He took a turn for the worst in the night. Maybe evil lurks in night. I don't know. I don't get that. Scott, what do you think about this?
Well, the temptation of the incentives with the ventilator, it was over the top. So when I started studying ventilators after Grace died, I found out that it wasn't just the $39,000 bonus for 96 hours on a ventilator, but the average hospital stay once a person was on a ventilator was 22 days. And so you add up the 22 days along with the bonus, and it was about a $300,000 payday for every time they put a patient on a ventilator. So, that financial incentive was, it's unfortunate that, people are motivated by money, and, the evil that money brought to the table with COVID is undeniable. If you add to that equation, I don't know if either of you have seen this, but AJ DePriest did the research, the white paper about blood money during COVID. And in her research, she found out that the hospitals were advanced money in anticipation of COVID patients. And if they didn't have enough COVID patients, they'd have to pay back the money. So it's, the hospitals had incentive after incentive after incentive to do these nefarious things. And I think Dr. Bowden mentioned earlier, if a doctor keeps doing the same thing over and over and over, if you think about COVID at the beginning, so I could see a doctor using a ventilator, for the first week, the second week, maybe even the third week. But when 90% of your patients are dying, doesn't it just, common sense would tell you, I've got to do something different. That's when, so when I see this happening, did a first offense drunk driver who hits somebody and kills them, is that murder? Well, I don't know that it is, but what if it's his 8th offense and it's the 8th person? Well, this is why I look at what happened with COVID as, these doctors who did that, that's murder.
Right. And that's what my thinking is we teach kindergartners patterns, when they get to kindergarten, and, red, blue, red, blue, red, blue, what comes next? And you would think that these doctors and nurses would see a pattern here. Right. We give them remdesivir. Oh, they have kidney problems. Oh, they need to be ventilated. Oh, they're going to die. Oh, a DNR, all these things, you can see the pattern forming. And at some point, even if the drugs weren't harming them, let's just give them the benefit of the doubt and saying the drugs aren't harming. Why keep giving them the same drugs if it's not helping them, if it's not healing them? Why keep doing the same thing over and over again and expecting a different outcome? That's called insanity. But right. Thankfully, Dr. Bowden, you did see that something needed to be changed, and you were successful.
Well, that's what I can't understand either, because I mean, job satisfaction for a doctor is seeing your patients get better. And when the buck stops with you, the problem is the buck didn't stop with these doctors, right? There was no responsibility. But when
stopped with a COVID test.
Yeah, when you have a true doctor-patient relationship, you are motivated to keep your patient alive. I mean, it's very distressing for most. It should be if your patient dies, if you have a relationship with them, right? And so that's what it infuriates me that when people question what I did, because I'm like, I wouldn't just do the same thing on thousands of patients if it wasn't working, right? I would pivot. If ivermectin didn't work, I certainly would not use it. I mean, there's no financial reason to use ivermectin at all. It caused me nothing but problems.
And why didn't they incentivize healing patients? Like, if you healed this patient, then we'll give you a bonus, Why wasn't that?
Yeah, well, the hospitals have so much power. Doctors like me are powerless, but they have so much negotiating power with the government.
That's right.
Yeah. Well, I have another clip here. I don't know if y'all want to see it or if you want to wrap up, because I'm telling you, I've struggled with this podcast, and it wasn't because of my guests at all. If it weren't for y'all filling in and helping me, this would have been a complete disaster. And, Stiletto messaged me. She says, just go ahead and reschedule it. And I was like, no, we're going to do it, because thank God I have two wonderful people who can have my back, not just in healthcare, but on a podcast. But I have the clips of the different drugs that they used, and I looked up all their interactions and stuff like that. But I guess we can go ahead and show it. Chris, can you play clip 8?
Pull up Doug's medical records and see his medications. Look at this. I counted 40-something drugs, but let's look at all of the drugs, fentanyl and Nimbex. Now, Nimbex is the muscle blocker, and the fentanyl, they react to it together and cause irregular heartbeat and low blood pressure. Fentanyl and propofol, they cause irregular heartbeat and low blood pressure. Dexamethasone plus insulin. The dexamethasone increases blood sugar, and then he's all of a sudden a diabetic and needs insulin. When you mix insulin with morphine or an opioid, it can cause death. You have hydromorphine and disoxane and fentanyl, midazolam. Those are respiratory depressions, and they cause cardiac arrest. We have adenosine and vancomycin that causes kidney failure, liver problems when they're combined, and respiratory depression. And then when you combine midazolam, propofol, that's irregular heart, low blood pressure. And it goes on, and you can see hydromorphine causes irregular heartbeat, high blood pressure, and suppressive. So all of these drugs are interacting with one another, and that's what he got. And he was getting them all. No one could survive that. He didn't go in bleeding. No. None of them went in bleeding. 5 blood transfusions.
They said that when they called me and asked me if he had prostate issues before he went into the hospital, and I'm like, no, he was healthy.
And you can see that he was given fentanyl, and the amount that he was given, that's like 109. And then at the same time, they didn't give him any propofol because those two interact. So you see the balancing act of what they do here. They lower one drug and raise another one. And did he need more propofol to sleep more? This didn't.
He couldn't even talk.
No, he had other sedative drugs in him at the time. And it's in conjunction with each other because they knew they interacted with it.
Look at the list of these drugs. He got 40, was it 43?
43.
Yeah. And you can see the sedative, the neuromuscular blocker, the sedative, the opioid, the sedative, the low potassium, that's one of the death row drugs that stops the heart. Sedative, the neuroblocker. This is just ridiculous. And you see what they interact with. It's just the steroids suppresses your immune system so that even if your body wanted to fight all of these things, you're getting your immune system suppressed with this steroid. And then the blood thinners, and they're giving you blood or drugs that cause clotting, so you need the blood thinner. It's crazy. And I want people to just take this in and see how many drugs one person is getting. You can't survive that.
Wow.
You know, it doesn't interact with any of those medications.
Ivermectin?
Right.
I was just fixing to say, and they want to go after the doctor who's giving ivermectin and healing patients. That is a chemical balancing act, and with what Scott was saying is the longer they're on the ventilator, the more payout. That's basically what they were doing, is chemically balancing their life, and extending it to get as much out of the patient and the payouts as they could. And the thing is they said in Scott's case that they didn't need informed consent, that they didn't need to tell you any of these drugs.
Greta, I don't know if you can hear me, but I'm curious if you ever interviewed case managers, because they're the ones that hold, when you are taking care of a patient in the hospital, you have the case manager breathing down your neck saying, when is the patient going home? I don't know if you can hear any of this, but it'd be interesting to talk to case managers. Yeah, you have? So have you talked to case managers about
No, I haven't talked to them. No, I mean, I can hear you, but no, I would love to talk to case managers, because a lot of the patients have said they were going home the next day when they got ventilated.
But, I wonder if the case manager, they were getting orders, right, from above. They would be an important source of information on the financial aspect, the motivations. Because historically, they've been the ones that are always pushing you out of the hospital. Like they were a thorn in our side as doctors, because they were always like, okay, when's the patient going home? When's the patient going home? Because insurance wasn't going to pay. So if insurance wasn't going to pay, you had to get that patient out of the hospital. But, there were perverse incentives during the pandemic. It was the opposite, right? It was good to have these patients in the hospital, and the case managers would be a wealth of information in that regard.
Assuming they would talk, I think that
the vast majority won't talk, but there's got to be a few that would.
They had a blank checkbook, so they used money to be able to facilitate this agenda. But this statistic I reference many times because it shows exactly what was going on. There's 200 reporting countries around the planet as to COVID hospital deaths, and America was number one in COVID hospital deaths with 1.2 million. How can we be number one on the planet with only 4.2% of the world's population? And number two was India with 534,000 deaths, and India's population is 4 times that of America. And the reason is because we are the leader in pharmaceuticals, and the whole goal of these, Grace lost her life. And so, all these people that have been shown tonight, you can see that they were purposely killed in a hospital. So those numbers could be jacked up to create the fear porn to hit the goal. The goal was to get the jab in people's arms. And, the hospital deaths had to be repeated over and over and over in mainstream media to facilitate the bioweapon agenda, period. End of story. I'm positive on that. That is how they pulled it off. When we are in a fearful condition, we do crazy things. And so even though, the jab was not tested, lie after, Operation Warp Speed. Oh my gosh, that's the biggest lie sold relative to COVID. And yet people are still buying the lie. Trump is still selling the lie of Operation Warp Speed Save the Planet. It's complete BS. But we're still buying, I'm not buying the lie anymore, but I mean, people are still buying that.
I had a patient today who's their primary care doctor yesterday told them to get the RSV, flu, and COVID shot. Crazy.
Insanity. Absolute insanity. Yeah.
And this man he did get 4 Moderna shots, and he went, and the 4th one, he got AFib 6 hours after the shot, and that's what woke him up. And he said no more. And then, but the doctor, of course, does not make any kind of correlation between that.
Yeah, well, of course not. Yeah, exactly right.
Hey, Greta asked me to play this short clip, so I'll get your take on it.
Now, doctor, does the standard of care allow for a patient to enter a DNR order unilaterally based on futility?
A physician, you mean? Patient? I'm sure. It does allow for a physician to enter the DNR order based on the futility rationale, which is that if a resuscitation wouldn't work to save the patient, it wouldn't achieve the goals, that you wouldn't do it.
Yeah, I remember that. So that's an example of how the defense can bring in an expert, and if you find an expert that will tell the story you want to tell, and they get up on the stand and they're deemed an expert. She was a doctor from Johns Hopkins, and that makes her credible. I think she was one of the ones that was paid, I don't remember her number, but I think she was paid $12,000 a day for her trial testimony. And, so she was only on the stand for an hour and a half and made $12,000. It's ridiculous. But that's what people believe, what the experts say. It was hard for me to grasp that the jury could not picture themselves in that position to say, would I want a doctor to unilaterally put a DNR on me? But, apparently they're willing to put their life in somebody else's hands.
That was my first thought as well. It's like this complete lack of empathy and realize, okay, what would I want? It sounds like I don't know, maybe there is some legal technicality that makes what she said true, but I have no idea. I'm not trying to give her the benefit of the doubt, but it sounds like some sort of legal loophole that she's trying to base that on, but it doesn't, it's unethical.
Well, the whole futility score thing is what she's basing it on. So, who determines that? I mean, it's the doctor who's going to put the DNR on you is the one who determines if you have a low futility score. It's insanity. I mean, we cannot. Anyway, I'm preaching to the choir here. I was very aware of this whole futility score thing before the trial because I've been researching as to how this stuff is even, what is the mindset? And, the mindset of this goes all the way back to 1905 with Jacobson versus Massachusetts. That's when the collectivism mindset was put into our system as a stake in the ground. And they have built on that collectivism mindset that people have a value, not an inherent value from God, but a value that is scoreable. And the non-contributing members of society do not deserve medical care. So that's the collectivism model. And that's what she was preaching from the stand, is the collectivism model.
Hi guys, it's Stiletto. Greta just messaged me to come in and ask you both, where we could find Dr. Bowden's book, if you could tell everybody, because she can't even speak and she wants to, wrap it up. So I'm going to step in here. So nice to meet you, Dr. Bowden and Scott. I heard so much about you. So I'm so honored that you guys could come on Street Talk.
Thanks for having us. Yeah, my book is you can pre-order it on Amazon. It's called Dangerous Misinformation: The Virus, the Treatment, and the Lies. So.
Thank you. Scott, any last words? I'm going to give you both some time to just any advice. I just want to say this, watching Greta, she's my warrior right there. I mean, to me, I'm a nervous wreck. I would have said, all right, it's a wrap. That's just me. It's a wrap. We're not doing no street talking with this, because Satan is always working. I saw your light flash off, Dr. Bowden. Even Scott did a little confusion on Rumble, but we're definitely being censored. There is no doubt in my mind. I mean, it's constant for me. I'm so used to it anyway, since 15. Hi, Greta. So did you want to wrap? You have enough time, to wrap?
I'm here. My husband's about to run out of gas.
So wrap it up.
Okay,
I'll just go ahead, Greta. Sorry.
I wanted to thank you both so much for coming. And I wanted to leave you really quick with a Bible verse, Galatians 6:9. Let us not become weary in doing good, for at the proper time we will reap a harvest if we do not give up. And thank you both for not giving up and being the fighters that you are and joining me here tonight, especially under these circumstances, and helping me out so much.
Hey, Greta, can I get some last words from Scott and then Dr. Bowden? Great. Go ahead, Scott.
The last words I have, I've been working on this, as the spiritual agenda. And what I see happening right now is people are putting their faith in man again. And the new king and the new HHS secretary are not going to save us. and it's very easily proven, but I will give you the scripture reference. It's Mark 3, chapter 3, verses 23 through 27. And the simple way to think about it is Satan will not cast out Satan. So we can have the evil and the less evil, and less evil does not fix evil. We've got to rely on God. We can't rely on man to fix this. It'll never happen.
Well said, Dr. Bowden. And you guys better come back with me on, because I want to meet you guys and have some street talk going on here. Go ahead, Dr. Bowden.
Well, Greta, you are amazing. I mean, you've done so much work and it doesn't get enough recognition. So I hope everybody, your website is just a wealth of information. I hope everybody will, educate themselves. I mean, the most common question I get from patients is, what happens if I have to go to the hospital? Because everybody's terrified to go to the hospital. And, your website, I always point people to your website. You have information on there that I don't even, I don't know, and I'm just learning. But yeah, and Scott, your story and your fight has been such an inspiration as well. And I'm very disappointed with the outcome of that trial, but you are educating people through Grace's experience. And so I'm grateful to you for that. And thank y'all for having me.
Thank y'all so much for coming. I just can't tell you how much I appreciate y'all. And I said y'all. So, and I appreciate you for having my back, because this was a crazy night. But we will definitely have to come back and do it again, and maybe it'll go a little smoother. But I still think we got a lot of information out there to help educate people, and I appreciate y'all so much.
Excellent.
Yeah, thanks. God bless you both.
Thank you so much. God bless you.
Bye.
Bye.
So, Greta, with you are a warrior. Let me tell you something. I would have already ended it. Okay, it's a wrap. See you later. So I just want to tell you, you are awesome. And like you said, there was enough information that people can sift through and watch this over no matter what. And I'm sure you're going to clip it up.
I want everyone to please share this. Hopefully that maybe I can do some editing and get out the bad spots. But keep putting this information out to others, because we are called to be watchmen. The Bible says, and God tells us, that we are to warn others. And if we don't warn others, then the blood's going to be on our hands if they happen to perish. And then if they do perish, but we've warned them, then the blood is not on our hands. But we will be judged accordingly based on that. So it's up to us to get this information out. So if you know something that's important and vital, share it out to everybody, please. And we ask you to share this information out. And with that, God bless everyone.